Hi everyone, thanks for listening to my presentation. Today I'll be talking about erectile dysfunction treatment, and I'll be going over the different ways to treat erectile dysfunction. If you have not listened to the causes, I would advise that you do, because by the time you know the causes, then you will be able to understand everything that I'll be talking about as per the treatment here. Okay, with that in mind, let's go. The treatment will start by identifying the cause. So if you don't know the cause, we'll be beating about the bush. For you to know the cause, you have to listen to my first presentation on causes of erectile dysfunction. But if you have identified the cause in you, or your spouse, or your partner, or your friend, then let's go. So the first question I'm going to ask myself, because I don't have the patient right before me, is this patient obese? If that is the case, if BMI is high, then we have to work on how to lose or shed the weight. Is this person smoking? Man, we need to go over how we can have smoking cessation. Is this individual boozing a lot? I mean, alcoholic? Then we have to have a conversation over that, because that must drop. Is this individual potato couch? I mean, sedentary lifestyle? Wow. Then we have to advise on how to start embarking on exercise. Is my friend hypertensive? Then we have to begin the treatment of hypertension. But I will not use some medications to deal with that. I would rather use calcium channel blockers instead of beta blockers. Am I dealing with a high level of cholesterol or lipid generally in this individual? Yeah, we will deal with that by treating hyperlipidemia. So we can use lifestyle modification as the first part of the treatment to help anyone having erectile dysfunction, after we must have identified the cause or causes. Counseling on identifying risk factors and working against the risk factors will help a lot of people without taking any pill from any physician. If we have taken the first step and we now identify the cause of the erectile dysfunction to be certain medications that has been prescribed or street drugs, the next thing is either to adjust the dose or change the medication to another medication entirely after discussing with the prescribing physician. And if it is street drugs, please just stop it. Stop it. If you have listened to my presentation on causes of erectile dysfunction, I've explained in details as per psychogenic erectile dysfunction. So I will not go over that right now so as not to waste your time. You can check that video. So if the cause in you is psychogenic erectile dysfunction, then counseling in the presence of the wife, and counseling the wife or the partner or the friend or the common law partner will help a great deal. If we are not winning at that level, we can refer to Psychiatrist. If there's associated depression or family disharmony, we can have family therapists to sort family disharmony out. Psychotherapy for psychogenic causes. Isn't that great? And of course, selective serotonin reuptake inhibitor is beneficial for men with premature. You understand the next what I will say, right? You have it on the screen here. And if it is anxiety, we can start teaching the individual on how to have focused exercises. And of course, we can refer to sexual therapist or counselor. But I'm not done yet. When the situation is psychogenic erectile dysfunction, we could still do more. Let's go. We can use Yohimbine in psychogenic erectile dysfunction for purpose of presynaptic beta 2 receptor blockage. Okay. We could also use Trazodone. Remember, I said if it is depression and you don't want erectile dysfunction, or you notice that the patient is complaining about erectile dysfunction and he is having depression and on antidepressant, you can use Trazodone because Trazodone will not give erectile dysfunction, will actually help with that, and at the same time be handling the depression. So for psychogenic erectile dysfunction, premature, and depression, we can use Trazodone. Still on psychogenic erectile dysfunction, psychoactive drugs will be useful in those with psychogenic causes. So you could see that I have not taken lightly the psychogenic erectile dysfunction, because if that is the situation, it is what we could handle, it is what we could treat if appropriate steps are taken. I mean, if counseling could occur, bring the two partners together, find out what the problem is, help them out, go over what I have presented as per the treatment of psychogenic erectile dysfunction, and you could get that solved and cured. Because erectile dysfunction could actually lead to depression to suicide, and nobody will want to hear that. Now, if they identify cause or causes, diseases like diabetes mellitus, hyperlipidemia, hypertension, peripheral vascular disease, and the rest, we will treat appropriately. So, see your doctor. Your doctor will carry out investigations, treat you. Now, if you're having diabetes mellitus with complication of impotency, if you have hyperlipidemia, they know the right thing to give you. If you have hypertension, they know what to give you. And if you have peripheral vascular disease, they know how to go about it. So don't keep this to yourself, please. Get out. Approach your doctor. Let investigations be done, and you'll be treated appropriately. Okay. Phosphodiesterase 5 inhibitors. Please, I need to categorically state here that you cannot use Viagra, Levitra, Cialis, and the rest in that group just indiscriminately. No. Do you know why? It can kill you. Okay? No phosphodiesterase 5 inhibitors if you are on nitrates. That is, if for the purpose of ischemic diseases like angina, myocardial infarction or heart attack, or for any other reason you have been prescribed and you are on nitroglycerin, azoxybate mononitrate or azoxybate dinitrate, please, no Levitra, no Cialis, no Viagra, none of those medications. And if you are on beta blockers, might be for tremor, secondary to hypothyroidism or for hypertension or for any reason whatsoever, please, no phosphodiesterase 5 inhibitors. Please. If you have decreased testosterone, you could be treated with phosphodiesterase 5 inhibitors in addition to testosterone replacement therapy. If you are on phosphodiesterase inhibitors and you are not winning, then you can use other methods that I will still talk about in a bit. That is the injectables, the vacuum devices, and of course, surgery. Do you know why I've been emphasizing no phosphodiesterase inhibitors in all these conditions? It's because of your heart. When you are on phosphodiesterase 5 inhibitors and you are taking nitrate, or you've been prescribed nitrate before, like nitroglycerin before, and you choose to go and pick any of these enhancing medications, phosphodiesterase 5 inhibitors, Levitra, Cialis, or any of them, anyway, Viagra, it will kill you with severe hypotension. And I'm making this warning because in some parts of the world where people might be listening to my presentations, they could just walk into pharmaceutical stores and grab anything they like. As a matter of fact, a good doctor, before prescribing this, will check all the parameters that you have a good heart that will be able to take or handle the medication. So it could be available, along the street in your country, but it's not meant for everybody. So be careful. Don't kill yourself, please. Now, the phosphodiesterase type 5 inhibitors. First example that's common worldwide is sildenafil, that is Viagra. It's like the rest, like Levitra, that is sildenafil, tadalafil is Cialis, and avanafil is Stendra and Spedra by trade names. They are phosphodiesterase type 5 inhibitors. They inhibit phosphodiesterase 5. They therefore increase cyclic GMP, and they are useful for all forms of erectile dysfunction. Remember my warning in the previous slide. You cannot use Viagra, Levitra, Cialis, or Stendra if you are on nitrates. Like someone having myocardial infarction or angina and is on nitroglycerin. Please, no. In fact, my best advice is just confide in your physician, because by the time they check your cardiovascular system, you might not be a good candidate to take any of these. If not, you can kill yourself. Phosphodiesterase 5 inhibitors, I will quickly go over some side effects. And the reason why I'm taking this is a lot of people with erectile dysfunction will want Viagra, Cialis, Levitra. They don't just want to know what will follow. So it is not used in association with nitrates. I have repeated that. I cannot overemphasize that, because there will be severe hypotension with nitrates. Other side effects could be headaches, dyspepsia, diarrhea, visual disturbances, and in the face of hepatic enzyme inhibition, the level of the phosphodiesterase inhibitors will actually increase. So if someone is on Viagra or Cialis or Levitra or Stendra and he is taking any of the azoles for fungal infection, then the dosage of the Viagra should be reduced, because the azoles are hepatic enzyme inhibitors, which means the metabolism or the clearance of Levitra, Cialis, or Viagra will be decreased. So the concentration will be higher in the system, So also will be the side effect. Will not give the same dose with azoles. In other words, you have to decrease the dose of Viagra if the same man must take any of these antifungals. On the other hand, enzyme inducers will reduce the level and effect of any of these phosphodiesterase 5 inhibitors because the clearance will be faster, the concentration will drop. It is better if you take it on empty stomach. And remember, you cannot take it immediately and expect action immediately. So it's going to take about 30 minutes to 1 hour. Reduce fat meal because fat meal can delay absorption of any of the phosphodiesterase 5 inhibitors. If you've done everything up to this stage and you're not winning or you're not getting enough satisfaction, then there's possibility of using suppository or injection, like using a prostate suppository, having it inserted into the urethra as male urethra suppository for erection. Okay, you know what? This is not good if your partner is pregnant. Ask me why. Okay, a prostate is a prostaglandin, and prostaglandins could stimulate uterine contraction. So if you use this, it is likely that your wife might have spontaneous uterine contraction and expulsion of the product of conception. That might be abortion depending on the age of the pregnancy. So it is contraindicated if your partner is pregnant. No approach study in pregnancy. You can also use it in form of injection, a caveat injection, the trade name EDs. It is injected into the base of the pill. And note this, we don't use this in individuals with bleeding disorders or individuals taking anticoagulants. In other words, someone probably because of family history or bleeding disorders or because they've been diagnosed with a particular bleeding disorder, then we don't give a prostate injection in such people or people that have ischemic situations on account of which they are taking anticoagulants. We will not use a prostate injection. And anyone taking a prostate injection may have priapism. So you can also have injection of vasoactive intestinal peptide, Envicol, ventolamine, aviptadil. Note this, they cause less pain and priapism is rare. To those with low level of testosterone, you can have testosterone replacement therapy. You can check other hormones to know if you need treatment for low level or high level. If you go over the presentation as per the causes of erectile dysfunction, you will see the different types of hormones that could be affecting anyone and lead to erectile dysfunction. So if I've just given an example here, but I'm not going to go over the entire list. If it is hypothyroidism, after doing TSH, T3, T4, you could be placed on Synthroid, and that might solve your problem. And chronic opioid users for chronic pain, because one of the P's of erectile dysfunction is pain. So you could seek expert opinion. You could add phosphodiesterase 5 inhibitors, but be careful with the blood pressure. Remember, opioids could lead to hypotension, And now you are adding another agent that could cause hypotension. Then you could be dealing with a severe hypertension. E5 alpha reductase inhibitors is the cause, like finasteride or dutasteride. You have to stop and check the vitals and discuss with the physician prescribing the medication. If it is alcoholism, remember, heavy drinking will lead to decreased testosterone. If all this you are not winning, you can turn to devices like vacuum pump. The vacuum pump will remove air to draw blood into the organ, and you can use elastic tourniquet at the base to hold the blood that is already drawn into the organ. That could cause bruising of the organ and may interfere with what I've written down here. If without this you are not winning, you could have surgery. There's possibility of peer prosthesis that could be implanted for men. In conclusion, all we need is a good doctor-patient relationship, and the rest will follow. You know why? Most males that I've known having this problem will hardly share with anyone besides their own partners. In fact, there was a scenario of a young man that came to the clinic and told the nurses that he was having rashes. And on getting into the consulting room, then he opened that door. He just didn't want the nurses to know that this is my problem. My problem is I've just gotten a new girlfriend and I've now not been able to meet her. Now, you understand that? So it is that serious. So doctors, please come to the level of those men, and you that you're having this problem, open up to your doctor. I believe he should be able to have your back, should be able to keep everything confidential. And of course, we also need the cooperation of the partners as well. Remember, I spent a great deal of time on psychogenic causes because you need to enjoy your life. No? Play this presentation over again, share with your friends and followers, particularly psychogenic causes. It's of the mind. And if there's good cooperation between the partners, then we could get out of that without taking a single pill. And you will enjoy yourself. And also, you will not unnecessarily be running after phosphodiesterase 5 inhibitors and get yourself killed based on the struggle to meet up. Okay? Good doctor-patient relationship, cooperation with partners, then you enjoy your life. With that, I've come to the end of this presentation. Kindly subscribe to my channel, share it with your friends, and wishing everyone well. Thank you.